husband Vance and I have 6 kids. Christopher is the 4th child. He's 8, almost 9. Well, we were really excited to be expecting our 4th child and did a lot of the normal prenatal testing that you do, the blood work and things. And then I got a call from my doctor, and when your doctor calls you personally, you know that that's not always a good sign. There's a good chance that Christopher's gonna have spina bifida. We had the talk and he got the trach, and then it was just so nice to see him not struggle for air. And he, it was like he was that happy little kid again. But when someone has a trach in their throat, they can't clear that plastic tube. And so if he gets a goober in his throat and no one's there to suction it, he's dead. I mean, you're done. You got 5 minutes. It's always, always in the back of your mind that, your kiddo's got 5 minutes. So Alliance has been on our team since the day Christopher came home. So you need to have backup, because I can't take a shower and suction him at the same time. I mean, you can't, make spaghetti and let him play outside without having people around that are aware of his medical needs. And so having nursing is just imperative. He couldn't be home without it. I treated him like every other kid, and it's like, we got ballet lessons to go to. We got library stuff, like, we're going. Well, we've got soccer at 4, so, get in the car, and if you need to bring a suction machine and the kangaroo pump and the formula and the batteries and the oxygen tank, you do it. So he couldn't go to school without nursing. I mean, I couldn't take him every day and leave my kids at home, and they have provided continuity and stability for him health-wise. Because they're here, he doesn't get sick as much. He doesn't need to be hospitalized for little things that I might not catch that could turn into big things. I think if you think that home health care nurses are like the flunkies that can't make it in the nursing industry, like, surgical nurses, you need to think again. Because one poignant story that I have told to many of our nurses is Christopher's in the hospital for surgery 21, and his home care nurse came to visit him in the hospital, and the children's hospital nurse is very professional. We've seen her many, many times. And she said, so what do home care nurses do? And I said, well, they do everything you do at Costco and the library and the zoo. And her jaw just kind of dropped, I never really thought about it. Your patient's in a bed waiting for you. He's at the Miracle League baseball game and he needs to be fed in cath, and you gotta go chase him down and do it while he's on third base. So, it really, to see the light go on her eyes, oh, this isn't some slough-off nursing, it was kind of funny. And when you have a kid like Christopher, it's worth it to work with an agency that you really trust. I think it's just having a heart for family and a level of professionalism, because it really is a life and death thing. And our night nurses, we couldn't do it without them. So they really are making a difference in the everyday lives of a family.